So sleeping positions can be modified if you're having shoulder pain at nighttime. The most common thing is if you have a slap tear or a tear with the bicep tendon or have a rotator cuff tear, that's typically many times more painful if your arm's above shoulder height. So most people end up finding a more comfortable position is with their arms sleeping down at the side. Many people also find if you put your arm sometimes underneath your head or underneath your pillow, it takes a little pressure off the shoulder also. If you are having shoulder pain at nighttime, many times the shoulder gets really inflamed, and when you get that inflammation, you end up losing some motion. So a smart thing you can do before you go to bed is to stretch your shoulder, just to make sure that you have kind of full range of motion. If you go too many days or weeks without having good motion, the inflammation gets worse, the scar tissue gets worse, and you end up getting more pain anytime you use your arm. So it is recommended if you think you're starting to lose motion, if you do just a series of simple stretches before you go to bed to maximize your motion, this can help significantly with the pain. Common question I get about shoulder pain, specifically at nighttime, is which works better, heat or ice? Most of my patients prefer heat in the morning. That's why people like a warm shower when they get up, because the shoulder's stiff after laying on it or sleeping in a certain position all night long. And then most people really like to use ice before they go to bed. It decreases inflammation, decreases the pain, and allows them to get to sleep and have a better night's sleep. Medications for shoulder pain, starting with the simplest medications, just over-the-counter medications that you can get from local pharmacy. One of the really good ones is Motrin, also known as ibuprofen. You can take up to 800 milligrams of ibuprofen up to 3 times a day. Most people don't do that. Most people underdose themselves, where they take 1 or 2 pills of ibuprofen a day, which is not therapeutic enough, especially when you're talking about a significant amount of inflammation and shoulder pain. Another simple over-the-counter medicine people can use is Tylenol. You can use up to 1,000 milligrams of Tylenol 3 times a day. Once again, most people don't use this dose, and it's not a dose that we recommend you take for a long period of time. But if you need to take that for a couple days to see if you can get the pain under control before you see a shoulder specialist, we do recommend that. So if you've had shoulder pain, you've taken the over-the-counter medications, you've rested the shoulder, you've iced the shoulder, and you're still having pain discomfort, that's when we definitely recommend you come to see a shoulder specialist. Greater than 80% of the time, we can treat you conservatively with real simple techniques. One of those techniques that works fantastic is a cortisone shot. The cortisone shot is an injection of a steroid, also known as prednisone, into the shoulder, which decreases the inflammation in the shoulder and decreases the pain, specifically if you're having trouble sleeping at nighttime. When all other options have failed and the shoulder pain is either affecting your occupation, your recreation, or your sleep, and we've had an MRI that documents what the true issue with the shoulder is, that is when we talk about shoulder surgery. There's a lot of horror stories out there about shoulder surgery, but the techniques that we use currently are advanced and really cut down on people's discomfort after surgery and really increase people's healing time so they can get back to doing all the things they want to do.